Thank you, Mr. Speaker. My question is to the Premier. Since April, 65 workers at the Port Arthur Health Centre, all of them women, have been on strike. They need a fair wage and health benefits so they can continue to provide great health care to the people of Thunder Bay. But the employer has refused to sit down. They've refused 3 requests for mediation from the Ontario Labour Relations Board and have refused to give these women a fair offer. And every day that the employer refuses to bargain, the people of Thunder Bay who rely on this clinic are struggling to get appointments, are struggling to get their medical information. They are forced into overcrowded clinics. They are forced to go to the overcrowded emergency rooms at our already beleaguered hospital and use the ambulatory care at our hospital as well. What will the Premier do to make sure that these healthcare workers get the respect they deserve and the people of Thunder Bay get the health care they need?
In here. Mr. Labour.
Thank you, Mr. Speaker, and I thank the member for the question and congratulate her on her election to the legislature. We are certainly aware of the situation, and we're monitoring it at the Ministry of Labour. You know, this situation, both sides are encouraged to work together to resolve the differences at the bargaining table. The Ministry of Labour mediators are available to assist the parties in the process, and I agree with the member. We hope that there is a resolution coming soon for the many reasons that she has mentioned. So we look forward to that resolution, hopefully coming soon between the two parties, to the member, and we will continue to monitor it.
Supplementary.
There are women at the Port Arthur Health Clinic who have worked there for 30 years. They have devoted their working lives to providing care to the families of Thunder Bay. I have received calls and emails with supporting those workers, and people are shocked to learn that they are making $14.71 an hour. Many of these women have been working casual for years, even though they work full-time hours, and they are supported by public health care dollars. And even though they work at a medical clinic, the employer has refused to pay them basic health benefits or WSIB. The employer has refused to come to the table. They have refused the help of the Ministry of Labour. I ask the Premier again, what will the government do to help these frontline workers and ensure that Thunder Bay can rely on the quality health care it needs? Thank you.
Minister of Labour.
To the Minister of Health and Long-Term Care.
Well, thank you very much for the question. I do appreciate this is a serious situation. We want to make sure that everyone in Ontario has access to the healthcare services that they need. Having said that, as the member knows, the ministry is not a party to these negotiations, but we do encourage both sides to get together to try and resolve this in the interest of the people of Thunder Bay area to make sure they receive the care services that they need. I know that everyone is concentrating on the best interests of the people in the community, and we look forward, hopefully, to a quick resolution.
Next question.